Okay, thank you everyone for being here today. My name is Anchina. I'm faculty in the School of Medicine at UC Riverside in the Department of Social Medicine, Population Public Health. And today we are presenting as part of our three-part series focused on mental health and well-being in Latinx and Indigenous Mexican communities with a focus on the Purepecha community, Indigenous group from Michoacan, Mexico. And we have our second presenter here with us, Dr. Pablo Ruiz, who will present on improving health and well-being, honoring culture and treatment and services. So thank you so much, Dr. Ruiz, for being here.
Thank you for having me. Yes, my name is Paul Pablo Ruiz. I am a fourth year psychiatry resident here at the UCR Department of Psychiatry and Neuroscience. And yes, today I'll be presenting on honoring culture and treatment and services as part of the medical provider series. I have no financial interest to disclose, and hoping we can have a discussion after and just kind of reflect on hopefully something that you took away from the presentation. And I'm interested to hear if you have any questions and how we can move forward with moving this series along into practice. So we can go to the next. Right. As far as the objectives of this presentation, they will include learning about traditional medicine in Mexico, as well as learning how to incorporate pre-existing indigenous clinic models. And then lastly, with a focus on walking away with clear examples of community-centered healing. And for the next slide, I'll be showing a video from a member of the Purepecha community discussing a family member's experience with a doctor's visit.
Muy buenas tardes, mi nombre es Albina Talavera y radico en el Valle Central. Soy de la comunidad Purépecha. Somos un pueblito en Michoacán. Somos muy conocidos por la danza de los viejitos, por muchas artesanías como las máscaras de los diablos. En este día quiero platicar tantito sobre lo que quisiera escuchar cuando voy al médico. Siento que es importante que puedas tener la confianza de llegar con tu doctora, y que puedas hacer las preguntas que tienes que hacer, porque muchas veces en la cultura de nosotros, una que nos da miedo ir. Y a la hora de ir se nos olvida qué es lo que vamos a preguntar por los nervios de que estamos ahí diciendo, ¿qué tal si no me siento a gusto? ¿Qué tal si no me responde las preguntas que quiero que me respondas? Siento que eso tiene que ver mucho cuando vas y te sientes con la confianza de poder estar tranquila. Siento que sería como cuando vas a la cita con el doctor, que te trate como una persona que, aunque no te conozca, actúe como que si te conociera, para que gane tu confianza. Porque muchas veces sabemos que también tienen ellos su agenda, y a veces están muy saturados, que a veces nomás entran rápido, te explican lo que te van a explicar y se salen. Y en el caso en mi familia, mi mamá, que no sabe escribir o leer, a veces a ella se le dificulta que estar leyendo lo que le manda el doctor, ya sea que le diga, oh, te tienes que cuidar de esta manera, estos son los pasos. Ella no sabe leer, ella va a decir, ¿ahora qué hago con esto? Se ha hecho difícil con ella para que ella pueda ir al doctor, porque, como digo, no hablas muy bien el español. Ella es más de pues el idioma purépecha, y aquí tienes que ir al doctor y la mayoría es puro inglés. Tenemos que acompañarla para que ella pueda ir a sus citas. Ay, no, pues sí me sentí triste, porque pues era un examen muy importante para nosotros. Para nosotros era importante porque es cuando le estaban tratando de hacer diferentes estudios para ver por qué ella tenía la hemorragia. Y al yo enterarme de que no le pudieron explicar el procedimiento que le estaban haciendo adecuadamente en su idioma de ella, o está yo y estarle explicando bien, sí se me hizo muy feo. De la clínica salí de esa cita, salí igual como si no hubiera ido, todavía pensando que van a ser los resultados.
Yeah, so in this video, clearly there's themes that come up as far as the importance of health literacy, the importance of trust between patient and provider, the curiosity, even if the provider doesn't know all the answers or know a person's culture entirely, that curiosity to learn a little bit more, as well as the challenge patients face when it comes to language and cultural barriers. These are all things that I thought of as far as creating this presentation, and ideally, this what I'll be talking about here is ways in which we can bridge that gap between basically where patients come in and that fear may be and uncertainty may be very wide, and how do we kind of narrow that or minimize that as much as possible. And so on, yeah, the next part of the presentation, this is where we're going to start learning a little bit about traditional medicine in Mexico, because this is something that's important, particularly for the patient population that we serve here in Riverside and in particular the Eastern Coachella Valley. All right, so for this, to start out this section, I'd like to start with discussing curanderismo. And this word comes from the Spanish word curar, which means to heal. Curandero is the Spanish word for healer. The curanderos practice a holistic form of traditional medicine, which focuses on healing the body, mind, and the spirit. There's healing through herbal remedies and surroundings, massage and body therapy, or limpias, which is a spiritual cleansing that with combining the elements around us. The roots for curanderismo can be traced as far back to the 1400s to the Aztecs, who sought remedies in what is now central Mexico. And curanderismo survived colonization, but as a result, it is a blend of Mexican indigenous culture and beliefs, and depending on the healer's religious, cultural, and/or tribal backgrounds, if any, may also have Catholic, African, or other influences. And in defining some of the terms we see here on this slide, I'd like to start with just a couple of them. So with susto, that's a terrifying event that causes the soul to leave the body and leads to unhappiness and illness, as well as difficulties in performing key social functions. Mal de ojo, or the evil eye, is a belief throughout Mexico, with each region having its own talismans, causes, and cures. It's believed to be caused from it's a believed to be a sickness caused from the transfer of negative energy from one person to another, either voluntarily or not. And Yeberro is a herbalist, partera midwife, sobadores massage practitioners. And I'll be further discussing some of these terms in the next few slides of this presentation, since these terms and the roles that people have are important when it comes to traditional healing in Mexico. Next slide. So to begin with limpias. So in exploring limpias deeper, there's spiritual cleansing that's used to cleanse the body, mind, and soul of negativity. They're known to remove bad luck, blockages, confusion, bad karma, witchcraft, imbalances, as well as help with addiction, phobias, and fears. The herbs that are often used in limpias are believed to absorb the negative energies of the body and in return provide the positive energies to bring peace and harmony to the person being cleansed. Because of like the grounding that's needed for a limpia and just being in the present, I do think of this as like a mindfulness practice. And the next slide also the use of an egg is a common practice in limpia, and it's often called limpia con huevo or egg cleansing. It's an ancient practice with an aim of trying to eliminate susto or mal de ojo, for example, which uses often an egg, clear cup, candle, and cold water. An egg in its shell is rubbed around the body to extract negative energy from one's aura before being gently cracked in the cold water. The outcome is read by what's seen, such as bubbles, which are often seen as a good sign. You may also see yolk streams, cloudiness, or an eye shape, which is a concerning sign. Intentional prayer, gratitude, and a call to the ancestors to help the egg kind of get rid of energies is done as cleanse as well. Next, sobadas. So these are traditional massages and manual realignment techniques, and the person who performs them is a sobador, or a person who's dedicated to treating muscle contractures, sprains, twists, and subluxations using large maneuvers, manipulations, manuals, and focused mechanical techniques. They're often used for musculoskeletal pain, childbirth recovery, or empacho, or indigestion type concerns. They're often performed by experienced lay healers or midwives. And this practice often also takes place in people's homes or community settings, not always in a clinical spa environment. For example, going to a sobadora's house with a simple setting and a strong personal trust. Safety and appropriate practitioner experience are important. Should not replace necessary medical care, but may serve as a complementary practice. And when utilized respectfully, it can serve as a meaningful wellness modality, particularly for those seeking body-centered traditional healing that integrates musculoskeletal, abdominal, and reproductive health. And as far as parteras go, so traditional midwifery or parteria, it's always been a craft which deeply values inherited wisdom. Many parteras or midwives learn skills like which herbs to collect from the land and use to make teas for mothers, how to give massages to move labor along or manage pain, how to move a baby into position, and how to care for it in the moments after birth. Many indigenous women in rural communities prefer to be treated by parteras because of the care they provide, the trust they have in them, because they speak their language, and because they treat them according to their spiritual worldview. So, to begin with Mexican herbalism, common household herbs are often used as digestive teas, mild relaxants, and culinary seasonings. They are often used for things like upset stomachs, colic, and for calming infusions, for example. Generally, they're safe in culinary amounts, but concentrated extracts can have stronger effects. And I'll be going over that as well during this part of the presentation. So I'm going to go over some of the common food items here that are also used as medicine. So to begin with, the jitomate or tomato has a variety of uses, such as aside from cooking, such as applying the leaf to cold sores. For fever, for example, two tomatoes are boiled, then wrapped as a plaster on the feet and left on overnight. The leaves can also be prepared in an infusion for a wound wash. Additionally, the fruit pulp is also used as a facial tonic. Next, as far as nopales or cacti go, modern studies of nopales have shown antioxidant and anti-inflammatory compounds, but clinical evidence for diabetes control is limited. They are generally safe as food, however. As far as yerba buena or spearmint, this is a mint that's been traditionally used for digestive complaints like nausea, gas, or bloating. Some evidence suggests spearmint may also help reduce androgen, the male hormone, levels in women with conditions like polycystic ovarian syndrome or PCOS. However, spearmint may not be safe in all situations because, in addition to potentially worsening GERD symptoms and its unknown effects in certain populations in large quantities, because of its anti-androgen effects, it may have interaction potential, for example, hormonal therapies, and unintended effects if misused. Additionally, the form of the spearmint matters. Many studies will use standardized extracts, for example, 900 milligrams a day, rather than simply a cup of tea. The effects may differ basically with amount, preparation, and quality. As far as manzanilla, so in English it's just chamomile, and it's often used for things like cramps, abdominal pain, and insomnia. Preparation for this plant includes infusion from dried flowers, but can also be used topically in compresses. It's generally safe for most people, but can rarely cause allergic reactions, especially to people allergic to other Asteraceae family plants. Another examples of plants from this family and their use include uh, peppermint for GI complaints and arnica and topical plants for musculoskeletal pain. And so because of the nature of these plants, it's important to discuss with patients that natural does not always equal safe. Because some herbs like epazote, rue, or hoja santa can be toxic in large quantities or contraindicated in pregnancy. So it's important to be diligent when asking patients about herbs or supplements they use and inquire the reasonings for use if it's not clear. It's important to be cautious when it comes to dosing, pregnancy, interactions with drugs, and toxic species. Also, keep in mind that the dosage, plant part, and preparation method matters. Teas, poultices, tinctures, or eating the fresh leaves differ in potency and risk. A reminder that many plants have not been studied in randomized clinical trials. Some have known pharmacological effects, but others are much less researched. And this is important for us to recognize and also to communicate with patients as well. And so for this next section, we're going to look into basically how providers can validate and also integrate the cultural practices of patients into clinical care. And so to begin, culturally responsive providers will respect traditions and when appropriate, integrate them into the treatment plan. These traditions can include things like acupuncture, herbal medicine, prayer. Um, and so, as I mentioned earlier, finding that rapport with patients, it is important to ask questions like, are there health practices, remedies, or healers you use that we should know about? It's again important to review potential interactions of traditional remedies with biomedical treatment. And in creating that partnership, it's critical to negotiate a plan that includes what the patient values, like herbal remedies, alongside what the provider recommends, like medications. An example of what this can look like would be like a provider supporting a patient's use of traditional herbal remedies alongside prescribed medical treatment, while again educating the patient about potential interactions and further inquiry about what they hope to get out of like the traditional forms of medical treatment as well. So regarding substance use treatment, since October of 2024, California actually has expanded access to culturally based substance use disorder or SUD treatment services. These services are deeply rooted in cultural practices and have been shown to improve health outcomes, particularly for individuals with substance use disorder. And so the first type of intervention included in this expansion is provided by traditional healers. Traditional healers, any person currently recognized as a spiritual leader with at least 2 years of experience practicing in a setting recognized by a Native American tribe or who is contracted or employed by an Indian healthcare provider or IHCP. Uh, Whereas a natural healer is a health advisor who delivers health, recovery, and social support in the context of tribal cultures. Natural healers can be spiritual leaders, elected officials, or instructional aides who are trusted members of a Native American tribe. And studies have demonstrated that these culturally centered approaches can enhance engagement and recovery outcomes, making them an essential component of holistic care for Native communities. And in terms of services provided by traditional healers, drumming, for example, has shown biological and therapeutic benefits to participants. Drumming may offer connection with the spirit world, a connection with one's ancestors, and a connection with one's culture and identity. A sick person's psychological and physiological states are believed to be altered by the rhythmic drum beats and accompanying song. And so the benefits of drumming can include things like creating a sense of community, wellness, and re-identification with one's tribal affiliation, all of which may help with mental health and substance use recovery. And also in many indigenous communities, storytelling is an integral part of the culture and provides a way for each tribe's history and cultural tradition to be passed down from one generation to the next. Through storytelling, providers and patients can build relationships while honoring tribal traditions. These stories can be utilized to help motivate tribal members to readopt healthy lifestyles and practices that were traditionally part of their culture that they may have lost contact with. And so, within the context of First Nations, just defining medicine man, it's a person with the power to heal or cure disease. And a medicine man or woman fosters agreement within communities, bridging natural and spiritual realms and mankind. Medicine when men and women learn their skills and garner powers in diagnosing and the use of medicine of herbs from medical societies or individual teachers and earn validation within the context of their communities. Medicine men and women garner power and visions of the supernatural from animals, plants, and natural forces that are utilized in healing. And so, when adapting care for religious or spiritual purposes, here are some other ways to incorporate cultural components into care. So, adapting scheduling, meals, and medication times accordingly is important to, again, taking into account what the patient values. Um, offer, it's also important to offer translation or culturally adapted patient education materials when possible. As far as advocacy and collaboration, it's critical, in terms of working with community leaders and utilizing resolutions like the United Nations Declaration on the Rights of Indigenous Peoples, because a declaration like this encourages nation states to comply and implement measures to support and uphold its provisions and basically looks out for the well-being of Native communities. And in terms of working with tribally run clinics, Indigenous run leadership will often know best what are the issues that there or the challenges that their people face and can better determine how to address those issues. And so using traditional healers and medicine and being able to refer to someone to a specific resource paramount to their healing is really critical to foster trust and cultural humility. Patients should be able to access resources that have been traditionally healing, and collaborating with leaders and seeing what's needed to provide culturally sensitive care is really important to patients' overall well-being. And that comes with curiosity. So, like, again, inquiring how to make access easier for patients. For example, services for picking patients up for appointments, or having interpreter services that speak the language of Indigenous communities within the regions pertinent to that clinic. And seen here is a list of tribal federally qualified health center providers in Riverside and San Bernardino counties. This is from the Department of Healthcare Services. When collaborating with tribal federally qualified health centers, it's just important to be prepared to reach out directly to a tribal council, if not the clinic directly. And when engaging with the community and its leaders, it's important to prioritize respect, humility, and curiosity when learning. Especially if you're coming from an institution like the UC system or looking to do research with Native groups, it's important to appreciate the long, violent history that colonization and the systems that uphold it today have played in the stories of these groups. Institutions should recognize that tribal nations are sovereign nations. Um, I like this quote from an author, Stephen Covey, that says, "You move at the speed of trust." So that's important, I think, to consider when we're thinking of how do we build rapport with with these communities. And now for the third section of this presentation, I will be focusing on community health workers, community-run clinics, and at the end, offer an opportunity for any reflection, discussion, questions. So yeah, one way to learn about the community and build community relationships is to talk with promotores or community health workers to improve patient care, build trust, provide culturally and linguistically competent health education, and to advocate for patients. They can help patients navigate the healthcare system, and this involves things like answering questions, pointing people in the right direction for services, helping them communicate with medical professionals, navigating an application system, or accessing social services or housing support. Their training helps them understand the system in ways that the people they serve often do not. And the next slide will feature a video that highlights the roles of community health workers.
The healthcare system in the United States is super different compared to people who are immigrating from different countries. Community health workers as people who can overcome that, who work with the community and have worked with people to help them get connected to regular healthcare.
We're able to provide you an overlook of what healthcare looks like with a friendly face that you can see.
I would say a CHW, somebody who breaks the barriers within one culture, and also somebody who helps the needs of other people.
I feel like community health workers are more tilted towards community and people than the system itself. Even though it is hard and complicated to go through hoops in our healthcare system, there are people out there that are willing to just walk it with you.
Just being able to understand the process of going to a doctor. And so that's where that CHW connection helps, because we help you navigate all of that.
Really what that looks like is it's that person in the community that maybe knows about a health fair that's going on or knows about this nonprofit and can help somebody get in touch with those resources.
Our office is your community. My desk could be any library. It could be any community center. It could be any venue event. And my scope of work is every single person that lives in our communities.
And so I wanted to also just give an idea of the importance of community health workers. And I think we can do this by looking at the role they played during the height of the COVID pandemic. So these frontline community workers often answered questions about vaccines and improved compliance with vaccine use. They played an integral role in serving low-income Latinx communities while also facing heightened risks to their own health and well-being. So I just wanted to point that out as far as this is a very integral role they played in the height of the pandemic, and they continue to do so in so many other ways that even followed the height of that pandemic. And not just to mention community-run clinics, such as the Coachella Valley Free Clinic. These clinics will often offer culturally sensitive and linguistically appropriate primary care services, often even mental health services, sometimes dental optometry services to underserved communities. I also find these clinics critical in the sense of there's often students that are part of these clinics. And so it does allow for the opportunity to teach and learn from the next generation of healthcare leaders, which is important as far as continuing this pipeline of continuing adequate care for these communities. And then I'd like to also mention in this section the Parawat Health Village. And I thought this was important to mention because this village is an example of community-centered healing with a focus on Native communities. The village is located in the city of Arcata within Humboldt County, up in Northern California, and is part of United Indian Health Services. And it does serve as a comprehensive place of healing in the sense of it has Western doctors, but also a native medicine man, a sweat lodge, and a community garden. Within this space, people can take nature walks. They have a chance to grow healthy foods there, and it's where people can tap into quote unquote the pharmacy of the world in terms of a lot of plants that can be used as medicine that are grown there in the community. And by focusing on a holistic and traditional approach to healing the mind, body, and soul, the center uses nature to give Indigenous people more control of their own health care. And so that brings us to the end of the presentation here, and I just want to provide this space to allow for any reflections or insights from this presentation. Trying to answer any questions and to thank you all for your time and attention here today.
Thank you so much, Dr. Ruiz. Do any of the audience members have any comments, questions for Dr. Ruiz? Feel free to also put anything in the chat. Okay, I'm going to stop sharing for a moment. And I would like to actually share a link to a brief survey that we have. I'm going to share this in the chat. And if you could all take a moment to provide, it'll take less than 60 seconds to provide any feedback that you or to respond to the brief survey and provide feedback about this presentation. So we will be sharing this presentation on our YouTube channel, as well as on our Unidos por Salud website, so that we can have greater reach. But thank you so much for being here and being part of this provider series. We have our last provider talk next week, and Dr. Muriel Casamayor, who is also here, she will be presenting specifically on the topic of trauma among Latinx and Indigenous Mexican populations. So thank you so much for being here, and we hope to see you next week as well.
Thank you.